Hello and welcome. Obviously you can see we are in a hospital. We work with 64 hospitals in 9 different countries with over thousands of employees. What we need to look at and discuss today is the differences between gentle self-defense and survival self-defense. In these situations, gentle self-defense, obviously you're calming a person down, you may need to restrain them without actually harming them and putting them under any stress. And on the other hand, you have survival self-defense. Survival self-defense is if you've got for example, a criminal who's trying to escape, okay, and that person comes at you and you have to defend yourself. What we need to do is first look at gentle self-defense. And what is it? Well, gentle self-defense is if a person is pushing you and you can easily control that situation, or a person is self-harming, hitting their head against the wall. There's no actually threat to you there, but you need gentle self-defense to control that situation. It's very possible that you come across a person who is smaller than you but wants to attack you. Yes, you can control that situation using gentle self-defense and control that situation. It doesn't matter if your self-defense is gentle or it's survival self-defense. One of the things we really need to learn is communication, how to talk with somebody, and then when to be assertive when it's necessary. A typical situation is when an employee is actually aggravating the other person through not being nice and not speaking gently to the patient. That then could escalate the situation. For example, I'm speaking to that, calm yourself down, everything okay? How's it? Yeah, calm down, no, there's no problem. Yeah, what happened? Stay calm, keep communicating, look at the person in the eyes and have a conversation. Whilst using gentle conversation and being calm, sometimes you have to be assertive. Once you've been assertive, then bring the situation, bring the calmness back down again. For example, patient starts getting a little bit rousty. You okay? Everything all right?
Look at me,
You okay? Hey, stop! Move back. Calm down. Is everything okay? Yeah? Yeah, what happened? Right, come on, we're going to move this way. Let's go. Let's move away. In some situations, you may find yourself being a little bit more assertive. What that does not mean is choking somebody or hitting somebody, but simply taking the person to the ground. The person grabs hold, colleague comes in, person goes to the ground, and the situation is under control. Now, this is something a smaller person can easily do and control that person. You may be in a situation where the patient is attacking a member of staff or attacking yourself. Okay, in that situation there, you protect yourself, hold the person from behind. From this position here, if you're strong enough, you can hold on to that person. If not, you may have to take that person down to the ground and hold and control the situation. This situation of controlling a person and taking a person to ground needs to be practiced many, many times. Not just from one situation, but from many different types of situations. For example, the patient could be trying to punch you, strangle you, grab hold of you, or they could be smacking their head against a wall. But you need to practice this thousands of times from different places, different situations, to make sure you're comfortable with the technique. So in this particular situation, we have a patient who is striking a colleague. Striking a colleague, he's going to come round, the second person comes in, restrains the person, holds on to the person, controls them and takes them to the floor. Once he's taken them to the floor, we're going to take the arm, push it under the head, block the elbow, and the second colleague gets on the legs to restrain and hold the legs. In this position, it's an ideal position to hold the person for quite a long period of time, but also at the same time, it's a good position if you have to administer any medication, because the butt cheeks are facing upwards. Now we're going to look at survival self-defense, and in these situations, you have to act immediately. You won't have time to be doing gentle self-defense. It could be where somebody's coming in with a machete or with a knife or a piece of glass, directly coming to do grievous bodily harm. In those situations, you have to act. If you know you have enough time in a situation you can prepare for that situation. For example, you can hide, you can grab yourself some wood. You have that little bit of time to actually think about what you can do to save yourself. If you find yourself in a situation where you have got a little bit of time before that person comes in, you need to look for tactical solutions, i.e. you're looking through the door, you can see that person's coming in. Can you possibly lock the door? Can you hide? So imagine how we got into this situation. We've got a patient here who's got a machete. Now, that patient could have actually brought that machete to the hospital as one of his favourite piece of equipment, and he doesn't want anybody to take it off him. Or it could be a visitor visiting the hospital and saying, hey, I want my brother out of the hospital, and threatening people with a machete. Obviously, we need to look at how to solve this situation. Trying to solve it with your bare hands is not an ideal situation. So we need to look at what equipment your staff have to deal with a situation like this. Could it be pepper spray? Could you use other items that are around you to help defend yourself against that machete? Again, pepper spray is a really good thing to use. However, your staff need to be aware that when you use pepper spray, it does not have an immediate effect. You can spray into the eyes and it takes time for that to affect the person before they actually calm down. And also with drug addicts, they could probably get pain in their eyes, but they would keep going and keep going because of the drugs that they're taking. The use of pepper spray we can actually show you in a later video. However, in this video we're going to look to show you what you can use, what's around you to defend yourself. The person is being attacked by the machete and we can use the chair. Use the chair blocking away, and also we have a crutch in there where we can block against the person. In this video we've tried to show you the gentle side of what we can do and also the survival side. Obviously, don't take this video as the be all and end all. What you need to do is you need to get on some of these courses. These courses can be tailored to your needs, obviously when you need to do them, how many people there are, etc. All you need to do is contact us and try and get on one of the courses. And we are more than happy to give you some simple training just so you can make up your mind whether this course is for you or not. Thank you for coming, and we hope to see you very, very soon.